hear me?
Very well. Go ahead, please.
Thanks a lot. Good afternoon, everyone. So my question is about Brazil, because the Ministry of Health said that COVAX would send 10 to 14 million doses of the Oxford vaccine to Brazil from February. But at the same time, PAHO said COVAX would deliver 35 million doses to 36 Caribbean and Latin American countries from mid-February. So it would mean that Brazil would get at least a third of doses from the region. I think there is, let's say, a confusion with these figures. Could you please clarify? Do you have the plan for Brazil? What can Brazil expect from COVAX in terms of doses and distribution dates? Thanks a lot.
Thank you, Bianca. I think we will start with Dr. Aylward. Bruce, you have the floor.
Thank you so much, Bianca. And as we mentioned last week, the COVAX facility now is getting a better sightline on the timing for the the emergency use listing of the products that it has in its portfolio. And the key ones are going to be the AstraZeneca products that are going to come out in hopefully be available from February. So what Bianca is referring to, just so everyone is aware, is over the weekend, the COVAX facility has looked at the available volumes, and then it's calculated for all of the participants in the COVAX facility, all 190 countries, what are what they call indicative allocations. So how much of that product maybe should be available to those countries starting from late February and then running into March and right through the first half of the year. Now, Bianca, I wish I could give you the exact numbers, but as there were 190 letters that went out yesterday, I'm afraid I can't remember exactly what's being allocated to which. And for clarification on that, I think the information's just gone out to the countries over the last day. They need a couple of days to reconcile that. And remember as well, the numbers that went out are indicative volumes, so they're ranges. So for one country, it could be from 2 million to 3 million, depending on what the final volumes from the producers are, whether or not all these products get through emergency use listing, et cetera. So I don't know what's exactly happened in terms of the numbers you're referring to, but sometimes people read the top end of the numbers and another audience may read the bottom end of the numbers, but there may be a couple of different reasons if they're not aligning. In the case of Brazil, you may be as well aware that they also have bilateral arrangements on the AstraZeneca product. So again, I'm not quite sure the absolute specifics, but I think the good news is that the COVAX facility has been able to go out to all the countries that are part of the facility over the weekend, give them the indicative volumes and a sight line on what they look like from February, which is a clear indication, of course, that that is the timeline to start delivering from the facility to multiple countries.
Thank you, Dr. Aylward. I would like to invite Dr. Simao to add some elements. Dr. Simao.
Thank you, Fadela, and very, very briefly, Bianca, because this indicative allocation is actually based on projections of what's in the contract. But it also takes into account, we will have to take into account the regulatory aspects. These vaccines will also need to be approved for emergency use listing in the countries, or emergency use authorization in the countries. And also we are still waiting to see the actual projection of how many doses will be available in February in March from the manufacturers, right? Because you will have seen there are some glitches in the manufacturing of the different vaccines at this stage, and there may be less volumes to be allocated. We'll know that in the next few weeks. But like Bruce said, this is an indicative allocation. There's a range, and we put it out so that countries know it will be coming, right? But the volumes have still to be addressed. The number of doses will still need to be taken into account according to the supply when the time is ready. Thank you.
Thank you, Dr. Simao. Dr. O'Brien, you have the floor.
Yes, I'd just like to make one other point. For self-financing countries in the facility, countries also informed the facility what fraction of the population they wanted to cover, and not all countries elected to cover 20%. Some of them went lower, some of them went higher. So the indicative allocations for any one country also represent, if they were a self-financing country, what their desire was that they communicated to the facility at the time when they committed to the facility. So I think it's just important that when any comparisons are being made across countries, there are a number of features that go into these indicative allocations. Thank you.
Thank you, Dr. O'Brien. I would like now to invite Tamara from Georgia to ask the next question. Tamara, you have the floor. Tamara, you have the floor. Can you please unmute yourself?
Yeah, thank you for this opportunity. I'm from Georgian TV company Formula, Georgian journalist, and I want to ask you that 2 days ago, Prime Minister of Georgia, Mr. Georgi Gacharia, made a statement that he had a conversation with Mr. Tedros, and that Georgia can expect the first batch of vaccines at the end of the February. Can you tell us more details about this conversation, and of course about the vaccine, when we can expect, how many doses, when can we expect, and which vaccine can also Georgia expect? Thank you for this opportunity.
Thank you, Tamara.
Thank you very much. I think this is a very detailed, what do you call it, need for information. And it's very difficult to communicate with countries on details of things through media. We have a channel to communicate with each and every one of them. So I'm really sorry, but it would be better to communicate through that channel, not through media. Thank you.
Thank you, Dr. Tedros. I would like now to invite John Zarakostas to ask the next question. John, you have the floor.
Yes, good afternoon. Can you hear me? Hello?
Yes, very well. Go ahead, John.
Yes. My question is basically, perhaps Dr. O'Brien can answer it. I would like to know, what is the current production capacity for COVID vaccines? What have the manufacturers conveyed to the WHO will be scaled up? And if we have a time period, because in previous influenza crises or pandemics, we had a good picture from industry where they were on the production. It doesn't seem to be the case right now.
John, I'll take the floor only to wish you a Happy New Year, and then to pass on to someone who will have a much better answer for you than me. Okay.
Let me start off, and there may be others who would like to contribute as well. The COVAX facility has committed supply of over 2 billion doses for 2021. The month-by-month indicative supply projections are available on the COVAX facility website. We'll be happy to post those so that you can easily access them. They are based on, not just for the COVAX facility, but frankly, the supply projections for all countries are based on projections from manufacturers about what their expectations are for yields of the vaccines and for the timeline of those yields and being able to produce the vaccines. As you know, for biological products, there is no certainty around being able to secure those yields with 100% assurity. And we are hearing about challenges that manufacturers are having on their production. So again, we have to emphasize that those month-by-month projections for the vaccines that have secured contracts are what they are. They are projections. and we are all in the place where we hope that those production expectations are met. In addition to the over 2 billion doses, there are also first right of refusal options on another billion doses in the COVAX facility for products that have not yet completed their clinical efficacy trials that are supported by for research and development, and therefore, as part of the contracts for support of that R&D, have the right of first refusal for the COVAX facility. And then thirdly, there are negotiations that are ongoing with additional manufacturers by the COVAX facility to secure additional doses. So I think, I hope that gives you a sight line for where you can find the month-by-month information and what that information actually means. And I'll turn that over to anybody else who might want to contribute.
Thank you, Dr. O'Brien. Dr. Aylward?
No, I was just going to say hi, John. It's Bruce here. Yeah, the simplest thing, guys, there's a fantastic resource on the web. Simplest thing is just Google COVAX forecast supply or supply forecast, and then you can go in and click on it, and it gives a great breakdown. Like, I just thought it'd make it a little easier for people to find it. What it shows is by quarter what the projections for that 2.2 billion doses look like, and then it also provides you breakdown in terms of regions, WHO regions, and AU view, a view by product. So it's quite a nice document that Gavi have posted. But the best part of the document is on what's on the right-hand side of each page, because on each page it has caveats and it explains what the challenges are around the licensing of those products, the yields, etc. So I think Gavi and the facility have done a great job trying to give people as much visibility as possible on the pipeline, and will continue to do so as they go forward. So that can be found there, but with the caveats on the right-hand side are what are so important, right? We're dealing with a biologic process here. All the manufacturers are working flat out to try and optimize their volumes. But at the end of the day, there are challenges as you move from developing clinical trial lots that you use for your trials to the commercial scale production. And often you run into problems with yields and other aspects that just mean your volumes end up being lower, as we've seen to the disappointment of many recently. But that's part of the challenge. Everyone's working very hard to get as much product as possible out there, but there will be setbacks and bumps along the road as we go.
Yeah, just to supplement that, as Kate and Bruce have said, manufacturing at this scale is a challenge where, wanting billions of doses suddenly, and the world is not used to manufacturing these many vaccines. So one thing we would like to encourage is for developers who now have vaccines that have passed the clinical efficacy trials to really explore how they can expand manufacturing capacity by partnering with other manufacturers that have spare capacity in different parts of the world. And this is something that would be useful for this pandemic, but also beyond that, because I think it will be building capacity in different parts of the world. And we set up a mechanism. The Director General announced the creation of something called the COVID Technologies Access Pool way back in May 2020. And that was really to encourage and enable anyone who had products, who had technology, who had knowledge or data that they wanted to share, could do it through that, thereby linking producers and developers who have the know-how with those who actually have the capacity. And we also have to remember that vaccines need the raw material. They need to be filled and finished and packed, but they also then need the syringes and the vials and everything that goes with getting the vaccine into people. So side by side with investments in manufacturing of the actual vaccines, we also need to make sure that we have the syringes and needles and the other materials that are needed. And that's the COVAX facility has been focusing on making sure that all of that happens as well. But I think more sharing of technology and looking at innovative ways of increasing production would help meet some of the shortfalls that we're seeing today.
Thank you, Dr. Swaminathan. I would like now to invite Isabel Sacco from FA to ask the next question, maybe the last one. Isabel, you have the floor.
Good afternoon, everyone. I would like to ask Dr. Alward about if maybe he has in mind information on the number of vaccines that the indicative allocation that he mentioned by regions. Maybe he can provide this information. And if I understand that it was said last week that this information will be available public. So I would like to know where and when this information will be accessible for all of us. Thank you.
Hi, Isabel. Thank you for the question. And sorry, I may not have been clear enough in an earlier comment. So about 10 days ago, the COVAX facility published on the Gavi website the allocations, indicative allocations by region and by month, starting from February, March period right out through. So if you go on to the Gavi, actually the easiest way to find it is to Google it. Just Google the COVAX supply forecast. So if you Google that, then you will find there's a link to a document which is updated regularly. We're going to try and update that every week or 2 weeks as numbers change. And what that document will provide is the indicative allocation by month and by region. So you'll be able to see for each of the 6 WHO regions how many doses they can expect during each of the months. Now, as mentioned in the answer to the last question, there's a lot of caveats or potential considerations that we have to bear in mind because producers may have smaller volumes than they're hoping for. There may be delays in providing emergency use listing of a product, et cetera. So these may change, but the indicative allocations are being published now on the site, and they can be found there. So if there's any trouble, just contact our media folks and we'll be able to make sure you have access to that important information. Again, with the caveats that these are very much indicative numbers, and you're all seeing the challenges some manufacturers are having reaching the volumes that they've committed to. So these are subject to some change as we go forward, especially in the short term. The other thing that was referred to by some of our earlier speakers was indicative allocations at the country level. But as the Director General said, those are direct communications to the countries, to the ministries of health between the facility and them, and BEST is working with them directly to understand what their indicative numbers could look like. But again, bearing in mind all the caveats, and I think it's going to be so important and helpful. Also, with the media, I'm not going to tell you your job, but I think the more we can help populations understand that, you know, this is indicative. This is if everything goes right. If there's problems, then the numbers will be lower and smaller. But everybody's doing everything possible to optimize those numbers. It all comes back to what Mike has been saying all along, and Dr. Tedros and Maria, though. In the meantime, we've got social distancing, we've got masks, we know how to prevent the spread of this disease, and we have to rely on those during this period, as tough as that is.
Dr. Ryan, you have the floor.
Yeah, thank you, Bruce. You're absolutely correct in terms of what we need to continue doing. But just also on that, with relation to vaccines, certainly Kate and her team and the vaccination team and our teams working in terms of country support with our regional platforms and the World Bank have been working on these vaccine readiness plans at country level, and they're all being currently uploaded into the public domain too. So everyone can see, especially donors and others, what it's going to take to deliver those vaccines. Because again, we've seen, even with small numbers of vaccines in some countries, part of the problem has been actually delivering those vaccines, generating the vaccine demand, doing the proper and safe vaccination, monitoring the implementation, and doing it properly. So vaccine is one part of the solution, being able to deliver those vaccines efficiently. So we would ask all donors and all investors and all financial institutions to look at those national vaccine plans and see where you can invest. It's not just an investment in vaccine we need. We need an investment in the country's capacity to deliver those vaccines sustainably. And also that will obviously help strengthen core immunization programs as well at country level. So I think there's a good investment there for everybody to support.
Dr. Benkirkov?
Yeah, I don't want to answer the question. I just want to take the opportunity to, as the least sports person up here, to thank Mr. Infantino for the leadership that sports players play around the world. I mean, one of the things we're learning is about being a good role model. And you brought it up in your answer that sports professionals at the professional level, but also at high school level, university level, even the little kid level, being a good role model is what we really need to see right now. It's very, very hard to keep up all of the hand hygiene and the mask wearing. But if we have sports players, we have leaders all over the world to show us that it's cool to do, it helps. And we can use all the help we can get. So as the least sports person up here, I wanted to say thanks because I didn't have an opportunity to say it before.
Thank you. Dr. Tedros, you have the floor.
Okay, thank you. So Maria had already said what I wanted to say, to thank Gianni. So I thank also all who have joined today, and thank you so much, and all the best until we see you in our next presser. Bye. Gianni, would you like to say something maybe as a closing?
Gianni?
That would be good, yeah.
The last word before we go. Well, of course. Yes. Tedros, thank you very much to all the team here. I mean, as a normal person who, like billions of those following this conference, is watching every day what is going on, I would simply like as well to commend all those persons here and all those who work to make our lives better, to save our lives. We want to play a little part in that, but what these ladies and gentlemen here are doing, the medical staff are doing, this is just incredible. We cannot underline it enough. And when I hear, and let me just say that as well, when I hear, sometimes criticisms here and there, some were mentioned even today, I can just appeal everyone. This is an unprecedented situation. We have to work together. We all make mistakes. Everyone makes mistakes, but we have to work all together. When I hear that vaccines have been developed in less than 1 year, I mean, this is incredible. This would not have happened without the great work of many people. We have to recognize that. Now, today I heard that there are around 2.2 billion vaccines, available. It's not enough. We need to do more, which means we have to work together. Let's join forces. Let's work all together. Let's support WHO, but all those who are working to save our lives. That's why we are here. That's why many players, football players, legends, sports persons, famous or not famous, are embracing this challenge and this fight all together, because united will overcome this. And for me, this is the most important message. Let's continue and let's win this match. Thank you very much.
Thank you very much.
Thank you, President. Just reminding journalists that you will receive the DG speech and the audio file of this press conference just after that press conference, and the transcript will be available on the WHO website tomorrow. Thank you all for your participation and see you next time.
আপনার কি ইউটিউব চ্যানেল আছে যেখানে আপনার সুন্দর সুন্দর ভিডিওগুলো আপলোড করছেন? আপনার ইউটিউব চ্যানেলে সুন্দর সুন্দর ভিডিও আপলোড করার পাশাপাশি সেখান থেকে ডলারও আয় করুন আর হয়ে যান একজন সফল ইউটিউবার। আমরা দিচ্ছি ইউটিউব মনিটাইজেশন সেবা। আমাদের সেবাসমূহ সাবস্ক্রাইবার্স, ওয়াচ টাইম, চ্যানেল মনিটাইজেশন। আমরা আপনার ইউটিউব চ্যানেলের জন্য সাবস্ক্রাইবার্স ও ওয়াচ টাইম দিয়ে করে দিব মনিটাইজেশন, যাতে করে আপনিও করতে পারবেন আয়। ইউটিউব মনিটাইজেশন করতে মেসেজ করুন মেসেঞ্জারে, আমাদের সেবা গ্রহণ করুন আর হয়ে যান একজন সফল ইউটিউবার। আপনার ডিজিটাল সেবায় 01 বিজনেস ডেভেলপমেন্ট ইনকর্পোরেশন